Okay, welcome. Today we're diving into something really critical. It's an escalating public health challenge.
Yeah, we're looking at the combination of extreme environmental temperatures, think serious heat waves, and, well, alcohol consumption.
Right. And we've gone through sources covering public health data, mortality rates, and the specific physiological responses that make this combination so dangerous.
So the mission today is to really unpack why a pretty common social behavior, drinking, becomes so much riskier as the planet gets hotter.
Let's start with the heat itself. What are we actually talking about?
Well, the WHO definition kicks in for a heat wave when ambient temps hit at least 40 degrees Celsius. That's about 104 Fahrenheit.
40 degrees, wow.
Yeah, and we saw that threshold just smashed repeatedly back in 2022. Parts of Spain hitting, 43 Celsius, California pushing towards 50, France seeing 38, 40 degrees.
And these aren't just uncomfortable numbers. This kind of heat can be deadly.
Absolutely. High ambient temperatures are linked globally with excessive morbidity and mortality. Lots of sickness, lots of deaths.
In the U.S. alone, the CDC reported an average of, 702 heat-related deaths per year between 2004 and 2018.
And the most acute danger is heat stroke. That's a life-threatening emergency.
Right, where your body temperature can shoot up to 42 Celsius. That's like 107, 108 Fahrenheit.
In just 10 to 15 minutes, it can lead directly to multiple organ dysfunction or, death.
We've seen this happen historically, right? Like the Chicago heat wave in '95.
Oh, yeah. That was devastating. Over 600 deaths. Thousands ended up in the emergency room.
And the projections for the future aren't great.
No, they're projecting that heat stroke fatalities could increase by about 2.5 times the current baseline by the 2050s. We're talking maybe 2,000 deaths annually just from heat stroke.
Okay, so the heat itself is a major risk. Now let's bring in the alcohol factor. This is where it gets synergistic, right?
Exactly. And it's relevant because alcohol consumption is pretty widespread.
Yeah, data from a few years back showed 1 in 5 employed U.S. adults reported binge drinking. And rates were even higher in younger and middle-aged workers.
So you have this backdrop of fairly common, sometimes heavy drinking, and then you add extreme heat. Why is that mix so bad?
Well, the key thing physiologically, as I understand it, is that alcohol is a diuretic.
Right. It makes you pee more. It promotes dehydration.
And dehydration is the last thing you want in extreme heat. Your body needs fluids to cool itself down, primarily through sweating.
Precisely. If you're dehydrated because of alcohol, your body's ability to regulate its temperature is seriously compromised. You just can't cool down effectively.
So that's the direct physical impact. But there's more, isn't there?
Yes. There's the judgment aspect, being acutely intoxicated in a hot environment. Well, it impairs your thinking.
So you might not recognize the warning signs of overheating. Or maybe you do riskier things.
Exactly. You might stay out in the sun too long, exert yourself too much, not drink enough water. It's why ethanol intake is specifically listed as a predisposing factor for heat stroke. It makes sense. Think about that classic dangerous example. Drinking alcohol while you're in a sauna.
Right.
That combination is known to sometimes lead to death from hyperthermia overheating. It perfectly illustrates that dangerous synergy we're talking about. Heat stress plus alcohol toxicity.
And we're not just guessing here. There's scientific backing, even from animal studies, right?
Yeah, studies on rats, for instance, show that high ambient temperatures alone cause things like weight loss and actual organ damage, changes in liver tissue at 40 Celsius, damage to the gut lining even at 35 Celsius.
So the heat puts stress on the body already.
And the alcohol just ramps that stress up, potentially pushing the body past its limits much, much faster.
So connecting all these dots, the severity of heat stress is projected to increase. We know that.
Right. And alcohol consumption remains, persistently high in many places.
So the combined impact, it seems like a really rapidly growing public health concern.
Definitely. It requires attention and probably some specific actions. Okay, so let's leave our listeners with this thought. The evidence is pretty clear that drinking alcohol makes you much more vulnerable to heat stroke. Yeah, it's a powerful predisposing factor.
So thinking about that, what specific interventions should we be considering now, especially for people who have to be outside, like outdoor workers? How do we address both the heat exposure and these associated behavioral risks at the same time?
That's the critical question we need to tackle.